A hematologic malignancy is a type of cancer that starts in blood-forming tissues, such as the bone marrow or the lymphatic system. These cancers affect the production and function of blood cells. Broadly, they include three main categories. 1. Leukemia, cancer of the bone marrow and blood, leading to abnormal proliferation of white blood cells, acute or chronic forms, lymphoid or myeloid types. 2. Lymphoma, cancer of the lymphatic system, primarily involving lymphocytes, Hodgkin lymphoma and non-Hodgkin lymphoma. 3. Multiple myeloma, cancer of plasma cells, a type of white blood cell that produces antibodies. They often disrupt normal blood cell production, leading to anemia, infections, and bleeding problems. Diagnosis usually involves blood tests, bone marrow biopsy, and imaging. Treatments can include chemotherapy, targeted therapy, immunotherapy, stem cell transplantation, and sometimes radiation therapy. CAR T-cell therapy is a breakthrough therapy for certain hematologic malignancies, specifically cancers of B-cell origin that haven't responded to other treatments. Emily Whitehead, first pediatric patient to receive CAR T-cell therapy, has incredibly remained cancer-free. I'll talk about CAR T-cell therapy more in details in another episode. Today, we will focus on other targeted therapy and companion diagnostic for hematologic malignancies. Here are current FDA-approved notable CDX for hematologic malignancies. Leucostrat CDX FLT3 mutation assay from Invivascribe detects FLT3 mutations in acute myeloid leukemia patients. These mutations are found in about 1/3 of AML cases and are associated with poorer prognosis. Accurate testing guides use of targeted tyrosine kinase inhibitors, like quizartinib from Daiichi Sankyo. Abbott real-time IDH1 assay identifies IDH1 mutations in AML patients, serving as companion diagnostic for targeted therapeutic drug ivosidenib, which has been approved for relapsed/refractory or newly diagnosed AML. Other CDX include Cobas EZH2 mutation test from Roche, and BCR-ABL fusion assay from Molecular MD Corporation. You may notice these CDX use PCR technology, which targets specific mutations. While this works well for confirming known mutations, it is not ideal for broader mutation or fusion detection needed for clinical trial matching or identifying emerging biomarkers. And that's where comprehensive genomic profiling, or CGP, plays a powerful role. CGP looks beyond single mutations, offering broad DNA and RNA analysis to detect a wide range of genomic alterations, from single nucleotide variants and small insertions or deletions, to complex gene fusions. Take FoundationOne Heme for example. It's a DNA plus RNA profiling test that can comprehensively evaluate over 400 DNA and 250 RNA genes, including SNVs, indels, copy number alterations, and fusions in blood cancers. It's New York State CLEP approved, though it's not an FDA-approved CDX yet. Press release indicated that several biopharma, including Syndax Pharmaceuticals and Sumitomo, have established partnership with Foundation Medicine to develop CDX for AML novel therapeutics, targeting NPM1 mutations or KMT2A rearrangements. Then there's the Oncomine Myeloid assays, including the GXV2, targeted next-generation sequencing panel specifically designed for myeloid malignancies, including 40 key DNA and 29 driver genes, plus a broad fusion panel. The assays are designed for rapid results, with some offering analysis in as little as 2 to 3 days. However, its CDX development roadmap is currently unavailable. There are no US FDA-approved NGS-based CDX for hematologic indications, but 2026 to 2028 could be an exciting period with potential approvals on the horizon. Another important aspect for hematologic malignancies is minimal residual disease, MRD, detection. MRD testing helps identify tiny numbers of cancer cells that remain after treatment, levels too low to be seen on standard tests. Detecting MRD early can signal relapse risk, guide treatment decisions, and improve patient monitoring in both clinical practice and trials. The table shows current MRD testing landscape. If you are interested, please leave a comment, and we'll talk about it in the next video. Hematologic malignancies are a major cause of cancer-related deaths, second only to lung cancer. Approximately 1.7 million people in the US are living with or in remission from these cancers. If you found this video helpful, please give it a thumbs up and share it with someone who needs to hear this. Stay curious, stay informed, and stay healthy.